how do I adjust my style to be effective to get my team members to execute what I need, and they have to hear me. So if I'm only speaking in my style, half of them won't hear me.
Well, if I'm a great clinician, great with my, hand skills, I can prep a crown, I can, do whatever as good as anybody, I'm going to be successful in this profession. And I think personality, communication, ability to communicate, ability to build relationships is far more important to a doctor's success.
All right, welcome back to the Apex Perspective. I'm your host, Matt Hale, and with me, as always, is my partner and co-host, David Lohmann. Our co-founder, Dr. Layla Lohmann, is back with us today. In our last episode, we talked about proactive care and touched on how communication shapes the patient and the team experience. In today's episode, we'll be diving deeper into communication inside dental practices and how it influences really the way the teams operate. Layla, thanks for joining us again.
Thanks for having me. I love joining you both and learning together.
Sure. Well, we love having you. We talked really last time about your philosophy, your practice philosophy, and how you've really become a leader in this idea of proactive care, and communicating what that means to your team was a challenge at first. And I know that as being a patient of yours myself, that over time, you've really been on this journey to become the most effective communicator you can be. Tell us a little bit about kind of how that started, where that came from, and what that journey's been like.
It's been a long journey. It's been a few years of me learning how to be an effective communicator. And honestly, I didn't know I wasn't effective. I always positioned myself as being a very effective and patient communicator. And when I realized how I was communicating was ineffective based on the numbers and reflection of my case acceptance and maybe just disagreements or frustrations that happened in my personal and professional life, I realized part of it was my communication. And responses are a reflection of my communication versus how someone's communicating, and I need you to understand me. And so my journey started a few years ago with learning what DISC was and understanding my assessments and how to leverage my strengths and improve my weaknesses to be an effective communicator.
Layla, you've mentioned DISC, and I think Matt brought it up. You introduced it in the last episode, but for those listening who may not be as familiar with the DISC assessment or DISC framework, give us a little bit of insight into how it works, what it ultimately provides, or insights it's intended to provide for you as someone taking that assessment.
Yeah, so most people think the DISC assessments and a lot of the assessments are personalities. In reality, it's adaptive and natural behaviors that you have internally, and it assesses which ones come out more or less in your personal and professional life. And it allows you to align. If you come home exhausted, it's typically because you're bringing or pulling out a communication style that doesn't feel natural. So when you take the assessment, I obviously hope you answer the questions honestly, not how you want the test to reflect how you are. But so if you answer the questions honestly and truthfully, you'll get an idea of how people perceive you and how you show up both at work and at home. And it allows you to understand sometimes the miscommunication is because you want people to talk the way you talk, when in reality, that's an unfair expectation. So when you get your assessment, you can then dive in deeper to understanding, why do I respond or react the way that I do? And it's because that's how I feel comfortable in communication. And then what it allows you to do, or what you should be leveraging when you use DISC, is not how to change other people's communication styles or my patients or my team members, but it's how do I adjust my style to be effective to get my team members to execute what I need, and they have to hear me. So if I'm only speaking in my style, half of them won't hear me.
It's interesting. So there's some self-reflective nature of this, but it sounds like also the insight helps you understand kind of the DISC profile of others, whether that's teammates, patients, and helps you understand how to best communicate in a way that the message will be well received. Am I understanding that correctly?
Yes, you said that a lot better than I did. That is that is exactly right, because my case acceptance and my other challenges where patients or my team members weren't doing what I needed them to do, was a reflection of how I was communicating things. And now when I know what other people's styles are, and there's a very easy way to do it if we were actually to look at DISC and the DISC and where they align. If I know people need me to slow down, I lower my tone. I meet people where they're at, even though I naturally talk fast. And the same goes with if they are task centric or people centric, I try to align that. And if you can do that really well, you can communicate and get people to do what they need to do more effectively.
It's an interesting concept, right? I think when you talk with most doctors, the belief is, well, if I'm a great clinician, great with my, hand skills, I can prep a crown, I can, do whatever as good as anybody. I'm going to be successful in this profession. And I think we over the years have really kind of fallen back that personality, communication, ability to communicate, ability to build relationships is far more important to a doctor's success. And a lot of times we talk about that in terms of them in the chair, them getting treatment acceptance from the patient. But I think a lot of what you've said so far is that it plays a major impact on their ability to lead their team, to build consensus, to build a culture alignment, all of those things within the practice, which obviously is clearly important. I think anyone listening to this would understand, but it's often not necessarily where our brain goes first on what values of a in a dentist tool bag, or what tools in their tool bag are most important to their success. I guess in your experience, are you kind of seeing that having taken on this journey and learned these tools over the last several years have made you a better leader in your practice as well?
Absolutely. I didn't even know it was a muscle I needed to keep training, because you just naturally go back to what you're really good at, the technical. Great with my patients. I'm like, my patients love me. And like, yeah, they do, but are they accepting the care that they need? And it's sort of a hard balance to also, my team members love me. Are they performing at the highest level that they can? Or are we making excuses or reasons why they can't? And it's really a reflection on your leadership, and you don't really know what that leadership muscle needs because you assume you're doing the best every single day, and you are. But I don't think people really understand how important communication is to reduce friction, to reduce the drama, to reduce walking on eggshells with that one team member or that one patient. It's actually a disservice to those people because you're not being clear, which is unkind. So the last 3 years, that I've been doing it, I learn something new each time that I even teach a course. As I'm communicating and trying to keep improving, how do I deliver the message? Am I hitting all the styles? And it's just really been powerful as a leader. My team feels more clarity. I'm not waffling at things anymore because I'm pausing and reflecting instead of needing to be seen as the dentist with all the answers, needing to be seen as the owner with all the answers. I humanize myself and just become better effective communicator, more effective communicator.
Matt, it's something you and I both certainly experienced building this business as well, right? If you go back 11 years ago when it was you and I in the office together each and every day, obviously there's a dynamic in this to a partnership, but it's easier to kind of learn over time of how one person best, how you both best influence or communicate with that one person. But as our team has grown, so have the different personality types, communication
Yep.
style, all of that.
Yep.
Just being try. I mean, you obviously lead our ops team. You have a much larger team that reports up directly to you. Talk about how this concept has been part of your leadership evolution as well.
Yeah, sure. Yeah, I think everybody realizing that everybody is not hearing what you think you're saying is the first thing, right? And I think Layla, I know we've had this conversation in the past, but you go through these frustrations where you're saying, why is this person not doing what I'm expecting of them, right? And so often it comes back to, well, they don't know what you're expecting of them. Well, I told them. Well, not in a way that they heard or understood, right? And so, I think one of the biggest differences is being in a place where you understand what that person's communication style is. You can slow down and think about how you need to deliver the message for them to hear you has made all the difference in the world in them having clear expectations and knowing what's expected of them. I think 90% of the time, once a person knows an expectation and you have a culture where they know there's going to be accountability for expectations, then they're going to perform to the expectations. If you get those two elements in place, then everything gets a lot easier all of a sudden. And I think that's certainly been my experience as we've grown, from the three of us originally to where we are today, is having that very intentional conversation about expectations in a way that can be understood and heard is one of the two essential elements to driving performance. Layla, I know you've had a similar experience in your practice.
Yeah, I would say, well, speaking of the organization first, I was hands off for quite a many years, dealing with what I do well. And when I learned about DISC, I think I came to you and I was like, we need this in our organization. And I didn't know your DISC style yet, and realized that was not the way to approach you. so so, as a high I, for those of you who probably don't know that, based on our interactions today, those listeners, I just get so much enthusiasm, so energetic and ready to go and execute that I don't think about logistics or don't think about some of the execution and organization. It's not a talent of mine. And so, year one, I was like, let's do this. And you're like, okay, sure. And you like didn't, you weren't dismissive, but you're like, how? And I
Mhm.
hadn't
Yeah.
thought about that. So as
Yeah.
an organization, as you're trying to bring things on, I think the more that you can communicate well with that leadership team on how and what does that look like through execution, it really has a bigger impact. So now, 3 years later, we are now bringing it in as a part of our onboarding and a part of our experiences. And that's really going to be helpful for role specific clarity, communication with your regionals, your offices, and that's from the operations side. So I'm going to switch to the team side. So when you told me no, I heard not yet. And I needed, what more information does Matt need to get a yes? And so
Mhm.
I started reflecting back on how do I do that well? And then I took it to my team and I said, well, he needs to see an ROI. Like he needs to see how is that return from my people promises and the culture. So I then took it upon our practice to get our whole team disc assessed because that's a practice level ability for team building. And I didn't execute it 100% right because my team was like, what's disc and why and all those things. But I learned how to hold monthly meetings more effective. And many times my teams felt unprepared because the C's and the S's of the disc style needed to plan and prepare and not be just, here's the agenda. We're going to expect everyone to give us feedback, and they don't like that type of communication. It's not comfortable for them. So I built that through our experience. I'm like, oh, that didn't go as well as I wanted, and it's been super effective. Like my team today, 3 years later, feel more comfortable with how we execute on our monthly meetings. How do we communicate as a team? And there's clarity for accountability. And you can see that in, little to no turnover. Our team members are more engaged and we're getting a lot more yeses, and our practice is more profitable because our team is gelling more.
Yeah, yeah. One of the things that I think is really interesting that we've realized over that time period is how important it is to fit the right roles with the right communication styles. We've certainly been through an evolution over time of having somebody that maybe wasn't the best fit in their communication style in a role where they needed to communicate a certain way. I'm curious if you could share a little bit about that within your practice team. You think about what styles have been really effective, or what accommodations for styles folks have had to make in that critical RDA role or in the critical hygiene role within your team, how you've seen that evolve as they've learned more.
Yeah, I think that when I thought about not necessarily is this style helpful or maybe just natural for them, it was more like, am I setting them up for success? If their natural style is one thing and their adaptive style, which is their work environment, is another, how do I help develop skills to balance it out more? And are they able to execute on that? So, role specific, when you're patient centric, some people need more energy. And so you try to look and see, how do I leverage what your style is and can I develop you to balance it out more? I don't know if that necessarily answered your question, but you definitely don't want in the um, role of execution someone who's unorganized. And so it means that you can develop those skills, but you may need somebody to balance it. So I would say that from an organization and team member standpoint, you're not going to not have a role just because of your style. You just may not be effective, which then can be demoralizing or frustrating for both parties because we didn't find the right role for you. Is that
Right.
kind of what
Yeah.
you're?
Yeah.
Yeah.
That's exactly.
You've been teaching DISC assessment in our organization for the last 2 or 3 years, and I think it's really easy for people, and especially if you're in a leadership role, a doctor owner in a practice, where ultimately, if you want it to be my way or the highway, you can do that. And in many cases, not necessarily saying it's going to be successful or it's the best path forward, but it is easy to take that bulldozer approach. As you have kind of taught this, how have you relayed that to doctors, office managers, in getting them to understand that adapting your style doesn't necessarily mean changing who you are? You're not giving up that piece of you, but how have you kind of encouraged people to digest this information, this knowledge, and put it into practice versus take the, well, they should adapt to me if they want to be here.
Yes, that is probably the most common thing of like what they say to me when I'm teaching it is, well, why are they not doing it? Or why won't they just do what we ask when we know we're saying the right thing? So I usually explain, how much time and energy are you using explaining and over explaining and still getting the same results? And I take that time to share with them through reflection of awareness, what are you currently frustrated with? And what is the current mode of communication that you've tried? And then we work backwards to where it's probably they did not know the style and they were bulldozing, I'll use that word, their style, and it was ineffective. And so when leaders, and I'm teaching it, I just explain, how many of us want to go home not exhausted, right? And most of us really resonate with that, if being tired. And I said, if you learn to adapt and modify your style, it protects your time and energy because you're very intentional with how you communicate by still saying the same thing and not changing who you are, but adapting how you speak, which it is very unnatural at first. You know this, A, living with me, but B, hearing about my conversations with our team members. And you've seen a big change of, you're more clear and concise. I still go on tangents at times, but that's when I'm in a safe space. That's when the I comes out. But when I'm teaching it, I now know the styles. So I'll get everyone to do their disc assessment first and I'll learn and plan how many people are this, how many people are this, and then how do I tie in the first 5 minutes, their buy-in. And once I get their buy-in and get their values, I promise I'll give you consistency, accuracy, control, energy, and loyalty. And when you know those are the things that they value, they're like, they already bought in, and I did that in less than 5 seconds.
Yeah. Yeah. So as we've developed this and trained more and more team members. One of the places I think we've seen it be very effective is when you're in a high stress environment or you're in a high stakes conversation. Could you share a little bit about some of those situations in the practice and how this has helped you get to better outcomes or helped your team members get to better outcomes in those situations?
It's a hard question because when you're in those high stake conversations, I even just got like a pit in my stomach, even though I'm not even in one right now.
Uh-huh.
Look, I think a lot of doctors, a lot of leaders in general. I say doctors because I think most of our listeners probably are. But a lot of leaders look. Hard conversations are hard. I mean, they're called that for a reason, right? It's not what most of us get excited about when we wake up in the morning. It's easy to avoid those. It's easy to punt on those, and I think tensions rise in high stress environments. Whether that is, hey, we've got a patient here to see to crown that we can't find. We are running behind in 3 columns of hygiene. We've got patients in the waiting room. The phones are ringing. Look, there's a lot of these situations. I'm confident throughout every day in a dental practice that probably heightens people's natural personality biases, right? I think what Matt's maybe question is where have you seen kind of understanding this disc assessment, understanding how to communicate to people's style has really been beneficial in those environments where somebody might otherwise shut down or you know uh, become combative in among the team. How is helping? How is you understanding? Man, that's a tough sentence. Understanding how your team communicates or receives communication helped reduce some of those stressful situations or at least the tension that might otherwise build in a practice.
Yeah, I'm gonna throw a little wrench. I think part of the communication part is amazing, but I think the confidence and mindset and awareness of triggers is paramount in communication. So, one of the things that I learned and we brought to the organization is inward and outward mindset, developing an outward mindset. And I think that in combination with communication is going to help me answer your question. So let me first stay about I have to know when I'm being triggered, pushed, going to get defensive, offended. Patients pushing back on me doesn't mean they don't like me, don't trust me. So there's a little bit of personal roadblocks that you have to check and understand that boundary first. And then the adaption, and then what we'll talk about in this series, in this podcast, is the communication part. So first, I have to know and check any personal roadblocks of not being trusted, being mistreated, being, unappreciated, any of those things in the mindset that will like not let me have a crucial conversation. Because if I am in any of that inbox, or, I talk about the inbox, then any crucial conversation is going to come out poorly and my outcome is going to be ineffective. The results I'll be disappointed with. So that was my first thing. And then let's say that we've worked on that mindset. I've built that, strengthened that muscle. So now I'm going to communicating with the team. And, the question, um, it is real, like all the heightened things. So I usually try to say, like, am I in a safe space to be able to have this conversation? And if the answer is no, I don't have that conversation then. I do say we need to have this conversation. At the end of the day, I'm very clear. No one's in trouble. We just need to reflect back on that lab not being in, or we need to figure out the process. So when I become an effective communicator, it allows them not to create a story. It allows me to frame what we need to be doing to execute on that patient promise or that people promise. Recently had an uncomfortable conversation with an office business manager where someone flat out asked me a question I was not prepared for. Old version of Layla would have been like word vomiting, all the things to try to get out of a hole, like to start just digging that hole
Just
way
talk.
worse. Yeah, it was bad. Old version. She was great, but like ineffective communicator. And this version, when I was addressed with a really hard question that I wasn't prepared for, I took a minute, less than a minute. I wasn't offended or defensive, and I answered it. Um, it wasn't comfortable. The answer wasn't what she wanted to hear. And we sat down, and in less than 30 minutes, we fixed something that normally would have taken 2 weeks, if not months, and built a toxic environment, both with me and my manager, but also the team. And so it's so powerful when you start adjusting and modifying your style to be effective, you don't feel like you're walking on eggshells anymore. You're very transparent, you're very clear. And I think that's the kindest thing you can do, even when the answer was not what she wanted to hear. And I also didn't want to have that conversation.
Layla, one of the things that you spend a decent amount of your time on within Apex is our vendor relationships, building relationships with our preferred vendor partners, our sponsors, things like that. But for an individual dentist, that may be a lab they use. We see all the time, we hear all the time. Um, well, I was using this lab, but I switched because I started getting a few crowns that didn't fit, or whatever that is. And we always ask the question, "Well, did you communicate that back?" And so often the answer is no. But how do you think, understanding this can help doctors with those external relationships as well, outside of their practice, but truly building long-term relationships that can endure bumps in the road, but that may reduce volatility in your practice. You're not switching suppliers all the time. You're not switching, equipment repair guys all the time. You're not switching labs, but really encouraging them to utilize this kind of better understanding of communication styles to get preferred outcomes.
Yeah, it's been a game changer, both within our organization and my personal practice. Really understanding what partnership looks like. You have to be a good communicator, and vendors are paramount to delivering on your patient promises. You can't do it without a good quality restorative product, a great lab, understanding that they're human, right? Anything that I do is not perfect. So it's an unrealistic expectation to expect everything 100% of that time. So with our vendor partners, it's been very interesting taking the approach of being an effective communicator. And this last 3 years is they're surprised about alignment and what success looks like. And when we get frustrated at, I just had a situation where I was frustrated at a lab that I've been using for 4 years. And it was a back and forth situation with email. And I said, let's stop this. Let's get on a call and let's get clarity. And before I would just switch a lab. I would just switch a product. And honestly, that actually was more destructive to my team because we had to learn new instructions. We had to learn new protocols, new workflows. And in my head, I thought it was a good decision because I was mad or frustrated. And you should never make a major decision in your professional life, personal life, when you are in your inbox. So that vendor relationship has been huge. They support us on a completely different level. You get competitive pricing, or even as a solo doctor, you start building relationships that when you need something, even if you are number 15 on that list and you call and you're a great communicator, they're going to bump you up because you see them as a partner, not as you need me. I need that lab because my patients need a crown. You see them as they're a part of my team. That restorative company is a part of my team. That lab is a part of my team. That support office is a part of my team. Would I just break up and get divorced tomorrow? That's probably no. I don't know, but you guys know.
Not personally, but I have I have a vested interest in this, obviously.
Personal interest.
That strikes me that there's a big parallel between the approach that you take on the vendor side, or we take on the vendor side, and the approach we take on the team member side, right? I think a lot of the approach that drives vendor turnover is the same approach that we see sometimes with practices outside the organization that drives team turnover. And all of the things you're talking about, taking those approaches, focusing on uh, thinking outward, focusing on communication style, focusing on having clear expectations, focusing on having conversations when things aren't performing or happening to those expectations. Those are all the same things that allow you to build a strong culture and keep team members for their entire career, as well as to keep vendors and have a stable set of vendor partners.
Yeah, well, it's so simple that you're like, well, why not? It actually isn't simple because you have to build the muscles. You have to be consistent. You have to be committed. And when I fail, which I fail all the time, I don't have a destructive thought pattern anymore. I focus on, did we communicate right? Were we clear? And part of the really cool thing about it is everyone tries to say, like, how do we fix it? I don't need to necessarily fix it. I need to adjust and modify, like, were we clear? Did we, that is actually the control that I have now. And it takes me a lot less time and energy by learning my style to be an effective communicator. And it gained me time back. So people still try to find ways and solutions to, let's fix the problem. Let's throw this at the problem. 90% of the time, the problem was me. I mean, unfortunately, so that level of awareness, that's really humbling.
Right, right. Yeah, this is one of those things that's simple but not easy, right?
Yeah.
Yeah, yeah.
Layla, you've done this podcast before. You know, we like to always wrap things up with some parting advice, and you talked a little bit about this just in your last answer of the ultimate outcome when you see communication breakdown. Kind of you turn inward and go, hey, what can I do to be better here? I want to back up just a little bit prior to that. What are the early warning signs that you see when communication is starting to break down in a team? What should doctors look for? Leaders look for more broadly to go, hey, until we get to, before we get to that point of things have gone off the rails, what are you starting to see or what do you start to see when you go, hey, we need a reset here or I need to pull somebody aside and get things back on track before they truly do go off the rails?
Yeah, the top two things that I find when I know miscommunication is happening or about to happen is blaming, complaining, and fault finding. If somebody's coming to me with a challenge and they start off with a complaint, I usually ask them, do you want to be helped, heard, or hugged? It was in a New York Times article because it's very supportive language that doesn't feel offensive. So I first do that as a natural fixer. And then when they answer me, I'll go down that pathway. If they go down blaming, I will stop that conversation right there because they're not looking at what their role was in the miscommunication. And then I'll identify and investigate through curiosity instead of just creating the story or feeding into their story. Like, yeah, tell me, oh, yeah, oh, she did that. Oh my gosh. I really had to take a minute and say, help me understand what did you do? Or tell me what happened beforehand. And then fault finding. If people are pointing fingers, and it's the whole thing, when you point one finger, three are pointing back at you, I will, if they're fault finding, I'll ask them a few more introspective questions of, were we clear on this? Did we talk about a deadline? And if the answer is no on any of those, we actually just stop that conversation because the miscommunication is partially our fault. So those are the top three things that I usually see when miscommunication happens. You guys know more than I do too.
No, it's right advice. Hearing you say that, I'm sure that anybody listening to this can go, man, I'm dealing with that 3, 4, 5 times a day. Even if you have a great team, a great practice, this is a successful practice. I think the reality is, if there's more than one person, more than you, you're managing personalities. You in many dental, across our industry, we're managing across multiple generations and a pretty significant generational shift in our industry. All of those things that probably contribute to this. So I think that's great advice, to anyone listening on what to look for and maybe how to begin addressing that before there's a true problem in the practice.
Yeah, great.
Thanks for joining us on the Apex Perspective. We look forward to having a further conversation with Dr. Layla Lohmann in our next episode.
Thank you. Bye.